Your hands are trying to tell you something. Most people don't hear it. Not because the signals aren't there. Because every doctor they've seen has been looking in the wrong place. Think about your hands right now. Not in an abstract way. Actually think about them. The way they felt this morning before you'd moved them properly. Whether your grip has quietly gotten weaker over the past year. Whether there are days your fingers feel like they belong to someone else. Whether you've started avoiding certain tasks, opening jars, buttoning shirts, typing for long periods, not because you decided to, but because your hands made that decision for you. Most people chalk that up to stress. Or sleeping wrong. Or just getting older. And then they move on with their day. But here's what's actually happening. If you have fibromyalgia, or if Sjögren syndrome is anywhere in your picture, your hands are already showing patterns that most doctors completely miss. Not because the doctors are bad at their jobs. Because they are not trained to look for these specific patterns in the hands. Because fibromyalgia and Sjögren's both affect the hands. Both cause stiffness. Both cause pain. Both cause that strange, exhausting weakness that makes you feel like you're losing your grip on things, literally and figuratively. And the overlap is close enough that one gets mistaken for the other constantly. But the difference between those two patterns? That's the difference between years of wrong treatment and finally understanding what's actually going on. Today, we are going through the 3 specific signs that tell them apart. Because what your hands are doing right now, that's data. And it's time someone decoded it for you. Before we get into the 3 signs, because I want you to be able to follow along properly, I put together a symptom map that shows exactly how these patterns show up in the hands. Type hand map in the comments and I'll send it to you. That way, as we go through each sign, you can compare it against your own symptoms in real time. Because most people don't realize what their hands have been telling them until it's already progressed further than it needed to. Here's why this gets so confusing. When most people think of Sjögren syndrome, they think of dry eyes and dry mouth. Those are the hallmark symptoms. The ones that get all the attention. The ones that usually lead to diagnosis. And when most people think of fibromyalgia, they think of widespread pain, fatigue, and that crushing cognitive fog that makes it hard to think clearly. Neither of those descriptions says much about the hands. But the hands are often where the earliest, clearest signals live. And in both conditions, those signals get misread, or missed entirely. Here's what a rheumatologist actually notices when they examine a patient with hand symptoms. They're not just asking where it hurts. They're asking what kind of pain. When it started. Whether it's constant or whether it comes and goes. Whether it's worse in the morning or worse at the end of the day. Whether it tracks with your overall symptoms or whether it seems to have its own schedule. They're asking what it feels like to hold a pen for 10 minutes. Whether you've noticed changes in your handwriting. Whether buttons and zippers have started to feel like puzzles. Whether you drop things more than you used to. They're looking for patterns. Specific, telling patterns that point in one direction or another. And there are 3 of those patterns that are particularly important. Because they look almost identical on the surface. But underneath, they're completely different. Now here's something that most patients don't know. The average time between the start of Sjögren's symptoms and an actual Sjögren's diagnosis is around 6 years. 6 years. And fibromyalgia, while often diagnosed faster, carries its own long history of dismissal. Patients being told their pain isn't real, their symptoms are psychological, their tests are normal so nothing must be wrong. What both of these conditions share, beyond overlapping symptoms, is a trail of misdiagnosis. Patients with Sjögren's get told they have fibromyalgia. Patients with fibromyalgia get told they have early arthritis. Patients with both get told they have neither and sent home with nothing. And the hands are where this confusion lives most visibly. Because the hand symptoms in both conditions look similar enough on the surface, that without knowing exactly what to look for, it's easy to get it wrong. Carpal tunnel gets blamed when it isn't carpal tunnel. Aging gets blamed when aging has nothing to do with it. Stress gets blamed when the problem is autoimmune or neurological or both. And in the meantime, the real process, whatever it is, continues. If your hand symptoms have never fully made sense with your diagnosis, this is why. And this is where the 3 signs start to matter. Sign 1. The morning that doesn't let go. Picture this. You wake up. You reach for your phone, or you try to make a fist, or you just try to move your hand, and it's stiff. It takes a minute. Maybe 5. Maybe longer. You've probably told a doctor about this. And if you have fibromyalgia, they may have nodded and said yes, morning stiffness is common. If you've been evaluated for arthritis, they may have noted it in your chart. But morning stiffness in fibromyalgia and morning stiffness in Sjögren's are not the same thing. And the difference is something most people never get explained. In fibromyalgia, morning stiffness tends to ease fairly quickly once you start moving. Your body needs a warm-up. The nervous system has been in a certain state during sleep, a state of lowered input, lowered output, and it takes time to recalibrate. But once it does, the stiffness releases. Movement is the signal the nervous system needs. It's uncomfortable, yes. Disruptive, absolutely. But within 30 minutes or so, most people notice it loosening. The key feature here is that movement helps. The body responds. In Sjögren's, that stiffness doesn't always respond to movement in the same way. Because in Sjögren's, the stiffness isn't primarily a nervous system recalibration problem. It's a structural problem. The immune system is attacking the connective tissue, the joint linings, the tendon sheets, the soft tissue that makes your hands move smoothly. That inflammation doesn't go away because you shook your hands out or did a few stretches. It's there because the immune system put it there. And the immune system operates on its own schedule. Sjögren's patients often describe a stiffness that hangs around. That doesn't dramatically improve with activity. That might actually feel worse before it feels better. That seems present regardless of whether they've moved or rested. So the question isn't just, are your hands stiff in the morning? It's, does moving actually help? And, how long before they feel like your hands again? If movement gives you real relief within 30 minutes, that leans fibromyalgia. If the stiffness seems indifferent to whether you've moved or not, if it has its own stubborn quality that doesn't respond to activity the way you'd expect, that's a Sjögren's pattern. And that distinction matters enormously. Because the treatment approach for nervous system-driven stiffness and immune-driven structural stiffness are completely different. What helps one often does nothing for the other. And if you're treating the wrong one, you'll keep wondering why you're not improving. There's one more layer to this sign that doesn't get enough attention. In Sjögren's, the inflammation in the hands can affect the tendon sheaths specifically. This is called tenosynovitis, inflammation of the sheath that surrounds the tendon and allows it to glide. When that sheath is inflamed, movement doesn't just feel stiff. It can feel like something is catching or dragging. Like the internal machinery of your hand isn't running smoothly. Some patients describe a grinding quality. Others describe a reluctance, like the hand is trying to move but something is holding it back. This is different from the diffuse, whole hand stiffness of fibromyalgia. In fibromyalgia, the stiffness tends to be more global. More like the whole hand is wrapped in something tight. In Sjögren's, it can be more specific. More localized to the movement of particular fingers or particular tendons. More mechanical in quality. That distinction, global diffuse stiffness versus mechanical localized reluctance, is something a rheumatologist notices immediately. And it's something you can start to notice in yourself. Sign 2. The grip that betrays you. Has your grip strength changed? Not dramatically, maybe. Not in a way you've been able to clearly explain to someone else. But you notice it. You notice it when you're trying to open a jar that you used to open without thinking. When you drop things at moments that catch you off guard. When you're holding a cup of coffee and suddenly you're not sure you're holding it properly. When your handwriting has changed in ways you can't entirely account for. Some people notice it in very specific activities, typing, knitting, playing an instrument, doing up the buttons on a coat. Something that requires sustained grip or fine motor control suddenly feels like it costs something. And here's the thing. Grip changes in fibromyalgia and grip changes in Sjögren's look almost identical from the outside. But they are coming from completely different places. In fibromyalgia, the grip problem is primarily a nervous system problem. Your central nervous system is amplifying signals, turning up the volume on every input your hands receive. So when you grip something, the feedback your nervous system gets from that grip is louder and more demanding than it should be. Maintaining grip feels like more effort than it should. The muscles themselves may be completely fine. The structural integrity of your hand may be completely intact. But the communication between your nervous system and your muscles is misfiring. Your body is treating grip as a higher cost activity than it actually is. And so you hold back, consciously or unconsciously, because it hurts, or because it feels exhausting, or because somewhere in the background your nervous system is flagging it as something to avoid. This is why fibromyalgia patients often find that grip problems fluctuate significantly. On a good day, grip feels almost normal. On a bad day, it feels nearly impossible. The muscles haven't changed between those 2 days. The nervous system has. In Sjögren's, the mechanism is structural. One of Sjögren's core features is dryness, and most people understand that as dry eyes and dry mouth. But that dryness extends to the internal tissues of the body as well. The synovial fluid that lubricates your joints. The fluid within tendon sheaths that allows tendons to glide. The moisture content of the connective tissue in your hands. When those tissues dry out, when inflammation disrupts the normal moisture and lubrication of the internal structures of the hand, grip changes fundamentally. It's not that the nervous system is misfiring. It's that the physical machinery of the hand is running without adequate lubrication. Tendons that don't glide freely. Joints that don't move with their usual ease. Connective tissue that has lost some of its pliability. The result is a grip problem that feels more consistent than fibromyalgia grip problems. Less tied to your overall pain and fatigue levels. More present as a baseline feature of how your hands work day to day. And in Sjögren's, that grip problem often comes with visible companions. Puffiness around the knuckles that doesn't track with injury or overuse. Skin on the hands that feels unusually tight or dry or fragile, not just winter dryness, but something that persists regardless of moisturizing. A texture change in the hands that family members notice even if you've stopped noticing it. Nail changes. Cuticle changes. Subtle but consistent. If your hands look different as well as feel different, if there's a visible quality to the change alongside the functional one, that's a Sjögren's signal that most people spend years attributing to something else. There's one more thing about grip in Sjögren's that almost never gets explained. The vascular system. Sjögren's can affect the blood vessels in the hands. The immune system can damage the walls of small blood vessels, disrupting normal blood flow to the fingers. When blood flow is compromised, the muscles and tissues of the hands don't get the oxygen and nutrients they need to function at full capacity. Grip fatigues faster. The hands feel heavy and tired after activities that never used to cause that. Sustained grip becomes exhausting in a way that seems disproportionate. Some Sjögren's patients also notice that their fingers change color in cold temperatures, turning white, then blue, then red as blood flow cuts off and then returns. This is called Raynaud's phenomenon. But even without the classic color changes, poor circulation in the hands affects grip. If your hands are chronically cold, if they are slow to warm up, if reaching into the fridge is uncomfortable in a way that seems out of proportion, if you're always the person in the room with the coldest hands, that's worth connecting to your other symptoms. Because in Sjögren's, cold hands aren't just a circulation quirk. They're a signal that the autoimmune process may be affecting your blood vessels. And blood vessel involvement changes the picture significantly. Sign 3. The signal you've been explaining away. The tingling. The burning. The feeling that your fingers are half asleep even when they're not. The pins and needles that appear without any obvious cause and don't go away when you shake your hand or change position. If you've experienced this, there's a good chance you've already been given an explanation for it. Carpal tunnel. Poor circulation. Anxiety. Just the way fibromyalgia works. And maybe one of those explanations is right. But maybe it isn't. Because tingling and burning in the hands, the kind that's persistent, that doesn't follow a clear pattern, that keeps showing up regardless of what you do, can be a sign of something that almost never gets caught on routine testing. Both fibromyalgia and Sjögren's involve the nervous system in the hands. But they involve it in completely different ways. And understanding that difference is one of the most important things you can take away from this video. In fibromyalgia, the problem is central. Your central nervous system, your brain and spinal cord, has lost its ability to correctly interpret and filter the signals coming in from your body. This is called central sensitization. The volume is turned up too high. Normal signals get amplified into pain signals. Ordinary touch gets interpreted as threatening. Temperature changes that should feel neutral feel extreme. So the tingling and burning you feel in your hands isn't because there's something wrong with the nerves in your hands themselves. The nerves are sending signals. But those signals are being processed by a central nervous system that has lost its calibration. What should be a neutral signal arrives as a painful or disturbing one. This is why fibromyalgia symptoms, including hand tingling, tend to follow the overall pattern of the condition. They get worse in flares. They improve in better periods. They are connected to sleep, stress, activity levels, and the general state of the nervous system. When the whole system is activated, the hands suffer. When the whole system is calmer, the hands improve. In Sjögren's, the problem can be peripheral. The actual nerves themselves, specifically the small nerve fibers that run through the skin and connective tissue of the hands, can be damaged by the autoimmune process. This is called small fiber neuropathy. And this is where things get particularly frustrating for Sjögren's patients, because small fiber neuropathy is almost impossible to catch on standard testing. Standard nerve conduction studies, the tests that get ordered when someone reports tingling and numbness, are designed to measure the function of large nerve fibers. They measure how quickly signals travel along the major nerve pathways. They're good at detecting conditions like classic carpal tunnel syndrome, where a specific large nerve is being compressed. But small nerve fibers don't show up on those tests. A patient can have significant, progressive small fiber neuropathy while every nerve conduction study comes back completely normal. This is why Sjögren's patients so often get told their nerve symptoms aren't real, or that they're anxiety, or that they're just part of fibromyalgia. The test comes back normal. So the doctor concludes nothing is wrong. But the test was never designed to find what's actually wrong. There's a test called a skin punch biopsy. It takes a tiny sample of skin, usually from the lower leg, and counts the small nerve fibers present. If those fibers are reduced compared to normal levels, that's objective evidence of small fiber neuropathy. It's not a perfect test, but it's the closest thing we have to directly measuring this kind of nerve damage. Most patients who need this test have never been offered it. Most doctors who treat hand symptoms don't think to order it. So what does small fiber neuropathy actually feel like? It's often described as burning that seems to come from inside the hand. Not on the surface, deeper. Like the hand itself is generating heat from within. Some patients describe it as feeling like a sunburn underneath the skin. It can also feel like tingling that affects all 5 fingers, not just the thumb and first 2 fingers that carpal tunnel typically affects. Not following the territory of a specific nerve. More diffuse. More whole hand. Some patients describe a hypersensitivity on the surface of the skin, where even light touch, fabric, or temperature changes feel amplified or uncomfortable. Others describe the opposite. A numbness or blunting of sensation that makes fine motor tasks difficult in a way that doesn't track with pain levels. And perhaps most distinctively, this kind of nerve involvement in Sjögren's tends not to follow the flare pattern. In fibromyalgia, the tingling and burning moves with everything else. When you're having a bad fibro week, the hands are worse. When you're having a better period, the hands settle down. In Sjögren's small fiber neuropathy, the symptoms can be more constant, more independent, getting worse on their own timeline, regardless of what the rest of the body is doing. Progressing even during periods when other symptoms seem stable. That's the detail that matters most. If your hand tingling and burning tracks with your overall symptom level, better and worse together, fibromyalgia pattern. If it seems to have its own schedule, its own progression, its own stubbornness, Sjögren's nerve involvement is a serious possibility. And if that's the case, what you need isn't a standard nerve conduction study. What you need is a rheumatologist who understands Sjögren's extraglandular manifestations, and possibly a neurologist who specializes in autoimmune neuropathies. That referral pathway exists. Most patients who need it are never pointed toward it. Now let's go deeper into the nervous system, because this is the layer that explains so much of why these hand symptoms feel so confusing, and why they are so often dismissed. In fibromyalgia, the nervous system has essentially lost its volume control. Every sensory input your hands receive, pressure, temperature, movement, texture, gets routed through a central processing system that is stuck in high alert. The signals don't get filtered the way they should. They don't get turned down to an appropriate level before the brain interprets them. What that means practically is that your hands may be working twice as hard just to perform normal functions. When you grip something, your nervous system is managing that grip with more effort and more alarm than it needs to be. When you type, the repetitive impact on your fingertips is being interpreted more loudly than it should be. When you're cold, the temperature signal gets amplified into something more distressing. This creates a kind of hidden exhaustion that most people with fibromyalgia recognize but struggle to explain. The hands aren't doing anything extraordinary, but they feel exhausted. Because the system managing them is running at a level that normal tasks don't warrant. In Sjögren's, the nervous system involvement is different. and in some ways more directly damaging. The same small nerve fibers we talked about earlier, the ones responsible for temperature perception, pain signaling, and the regulation of blood flow in the hands, these fibers also help manage the skin barrier of the hands. They communicate with the immune cells in the skin. They regulate the tiny blood vessels that keep hand tissue healthy. When those fibers are damaged by Sjögren's, multiple systems are disrupted at once. Temperature regulation in the hands becomes impaired. That's why the hands get cold and stay cold. That's why temperature transitions, going from warm to cold or cold to warm, cause disproportionate discomfort. Blood flow regulation becomes impaired. That's the connection to Raynaud's. But even without classic Raynaud's, chronic low-level disruption of blood flow affects how the hand tissues function, heal, and tolerate activity. Skin health in the hands deteriorates in ways that go beyond simple dryness. The skin becomes more fragile. Healing slows. Small cuts or irritations take longer to resolve. This is what's meant when rheumatologists describe Sjögren's as a systemic disease. It isn't just attacking the tear glands and salivary glands. It's creating a state of chronic inflammation and immune activity that affects tissues throughout the body, including the intricate, nerve-dense, vascular-rich structures of the hands. The fatigue in your hands, that disproportionate, hard-to-explain exhaustion after tasks that shouldn't exhaust you, isn't weakness. It isn't something you're imagining. It isn't something you should have to push through without explanation. It's your nervous system paying a tax it shouldn't have to pay. And it's your hand tissues operating in an environment that the immune system has made chronically more difficult. That's not in your head. That's in your wiring. That's in your biology. I want to say something directly, because I think this needs to be said clearly. If your hands don't feel like they used to, if everyday tasks take more out of you than they should, if the tingling or burning or stiffness is something you've just quietly started working around because no one has given you a satisfying explanation, that matters. It matters even if your X-rays are normal. It matters even if your standard blood work came back unremarkable. It matters even if your nerve conduction study showed nothing. It matters even if you've been told it's just fibromyalgia and left at that without anyone explaining what that actually means for your hands specifically. It matters even if you've been handed a diagnosis that explains some of your symptoms but left others floating without context. And it matters even if you've started to wonder, in the quiet moments, whether you're imagining it. Whether you're being too sensitive. Whether everyone's hands feel this way and you're just the one making something out of it. You're not. Here's something important to understand about why tests keep coming back normal. X-rays are excellent at showing bone. They show fractures, joint erosions, the bony changes of severe arthritis. What they cannot show is soft tissue inflammation. They cannot show tendon sheath swelling. They cannot show autoimmune damage to small nerve fibers. They cannot show impaired blood flow in capillaries. In both fibromyalgia and Sjögren's, the damage is occurring in structures that X-rays simply aren't built to detect. Standard nerve tests measure large nerve fibers. As we discussed, small fiber neuropathy, the kind that Sjögren's causes, is invisible to those tests. A completely normal nerve conduction study does not rule out significant nerve involvement. It just rules out large fiber involvement. Standard blood work measures things like inflammation markers, cell counts, and metabolic function. In Sjögren's, inflammation markers like ESR and CRP can be normal or only mildly elevated even when there is significant active disease affecting the hands. The disease is operating at a level of detail that routine blood panels don't capture. The absence of findings on standard tests does not mean nothing is wrong. It means the standard tests are not designed to find what's actually wrong. Your symptoms are real. Your experience in your own body is real. And you deserve an explanation that actually accounts for everything you're feeling, not an explanation that accounts for the easy parts and dismisses the rest. Let's bring the patterns together, because this is where things start to feel clearer. If your morning stiffness clears up within 30 minutes of moving your hands, that leans fibromyalgia. If it lingers regardless of movement, if it has a mechanical or catching quality, if it seems indifferent to whether you've been active or resting, that leans Sjögren's. If your grip problems track directly with your pain and fatigue levels, better on good days, worse on bad days, that's a fibromyalgia pattern. If your grip problems are more consistent, more structural, more present as a baseline, and especially if your hands also look different, with puffiness or tightness or unusual dryness, Sjögren's is more likely in the picture. If your tingling and burning flares with everything else and calms down in better periods, fibromyalgia pattern. If it has its own schedule, progresses independently, feels more constant and less connected to your overall state, and especially if it affects all 5 fingers rather than following a specific nerve territory, that's a peripheral nerve involvement pattern that needs specific evaluation. And if your hands are chronically cold, if temperature transitions are disproportionately uncomfortable, if you notice color changes in your fingers in cold environments, that's a vascular involvement pattern associated with Sjögren's that rarely gets connected to hand symptoms. Now, none of this is a diagnosis. Many people have both conditions simultaneously. The overlap is real and it's common. But knowing which pattern your symptoms follow, understanding which direction they lean, changes how you advocate for yourself. It gives you specific language. It helps you ask specific questions. It helps you push back when you're given an explanation that doesn't account for all of it. And there's more to this picture that we haven't covered yet. Because the 3 signs we've gone through today, those are the starting point. They're the layer that most people haven't had explained to them. But there's a second layer underneath. There are progression patterns, specific ways that both conditions tend to evolve in the hands over months and years, that most people don't know to watch for until something has already shifted in a direction they can't easily recover from. There are combination patterns, specific clusters of hand symptoms that, when they appear together, point significantly more strongly toward one condition than the other. There's the question of what happens when the nerve involvement and the vascular involvement and the soft tissue involvement occur together, because in Sjögren's, they can, and the combined picture is something that requires a very specific kind of attention. And there's the question of what to actually do with this information. What to say to your doctor. What tests to ask about by name. What kind of specialist to ask for a referral to. How to frame your symptoms so that the appointment goes differently than the last one. I haven't put all of that in this video. I've put it somewhere more useful. I put together a symptom map. It shows how these patterns show up in the hands, both in fibromyalgia and in Sjögren's, side by side. What each sign looks like in each condition. What the subtle differences are. And what each pattern typically points toward. It's designed so you can take your own symptoms and start to map them. Start to see which side of the picture they belong on. Start to build a clearer story of what your hands have been trying to communicate. If you haven't typed hand map in the comments yet, drop it there now and I'll send it to you. Because everything we've covered in this video is exactly what that map is built around. And if you've been managing your symptoms for a while, maybe for years, and something still doesn't fully add up, if the diagnosis you've been given explains some things but leaves others without a satisfying answer, type confused in the comments. I'll send you the symptom map plus a breakdown of the most common misdiagnosis patterns I see between these 2 conditions. The specific ways fibromyalgia masks Sjögren's. The specific ways Sjögren's gets dismissed as just fibromyalgia. And what to do about it in a practical, appointment-ready way. And if your symptoms feel real and significant but your tests keep coming back normal, if you've been in that frustrating place where you know something is wrong but you can't get anyone to find it, type normal tests in the comments. Because there are specific evaluations, skin punch biopsy for small fiber neuropathy, nail fold capillaroscopy for vascular involvement, specialized autoimmune panels that go beyond standard blood work, that most patients with these conditions are never offered. Not because they don't exist. Because most doctors don't think to order them. You deserve to know they exist. You deserve to be able to ask for them by name. Your hands have been trying to tell you something. They've been sending signals that have been misread, or dismissed, or attributed to the wrong cause. And the longer that continues, the more the underlying process, whatever it is, gets to run unchecked. The nerve fibers that are misfiring or being damaged don't improve on their own when the underlying condition isn't being addressed. The connective tissue that's inflamed doesn't settle when the immune system driving that inflammation isn't being managed. The vascular changes that are disrupting blood flow to your hands don't reverse themselves when no one knows to look for them. Early recognition changes the trajectory. Not just for your comfort in the short term. For your hand function over years and decades. Because your hands are among the most important tools you have for engaging with the world. For basic daily tasks, preparing food, getting dressed, writing, using your phone. For the things that matter to you specifically, whatever that is. Music, craft, work, care for the people you love. Protecting that function is not a small thing. It's worth fighting for. And it starts with understanding what your hands are actually telling you. Most people miss it. You don't have to.